Everybody, round two. I get to introduce Dr. Julie Babcock. We've only known not even a year, maybe?
Not that long.
Okay, not that long.
Yeah.
So we're always looking for holistic dentists. And so a lot of dentists say they're holistic, but they're really not. Or they know a little bit about holistic dentistry. And so when we found Julie, amazing. Like, same philosophy, on board. Don't do anything that's not necessary. Teach you the truth about what you need. You know, like my wife was totally lied to by a dentist in Hawaii, got all these fillings. It was just a mess, okay? And unfortunately, there's a lot of not good stuff going on out there. So to find a holistic dentist that knows their stuff, that's been through the training, that has the heart and compassion to tell you what you really need to do. Oh, that's a cavity, but gosh, don't worry about it. It ain't that big deal. Like, we live in a world where every cavity, like, you gotta get a filling, you know? And she's not like that. She'll teach you the truth of what you do and don't need. And so she's gonna share some wisdom on children's dentistry, and yeah, we're excited that we found her. We send everybody to her. That's like the only, I mean, there's a couple others in town, but she's who we refer people to. Get on her schedule because she's really busy. So anyway, thank you for being here.
Yeah, thank you. Yeah, thanks a lot. Yeah, so I'm a dentist. I'm over at 143rd and Metcalf, so I'm not too far away from here. I love being a dentist. I love teeth. They're beautiful. God made teeth amazing. Every cusp tip, every groove, every curve, everything about a tooth is absolutely beautiful. When you really study it and know it and understand it and understand how the whole thing works, there's no accidents there. And as dentists, we get in there and we really mess things up. We mess up the bite, we drill holes in teeth, we do all kinds of horrible things. And they say that dentists kill people a little bit slower than doctors do. Just takes us a little bit longer to get the job done. So I haven't been in this world very long, honestly. For about 18 years, I was normal. I was a regular dentist doing the normal stuff. I think I was doing a good job, but I didn't really get it as far as this kind of thing. So what happened is I found myself single when I'm in my mid-30s, and so I did like any other self-respecting professional do. I got on Match.com and met a guy who's a chiropractor. I almost didn't go out with him because he's a chiropractor. He's a kook, a quack, a weirdo. I didn't want to be around it, you know. But he's a nice guy, and so we talked more, and he just started making more and more sense. And he was really growing and changing too, from chiropractic to a lot more integrative medicine and some really interesting stuff. And he was learning about heavy metal detox, and he needed a dentist to get mercury out of his patients. And I thought, no big deal, you know, it's fine. It's a big myth. It's all fine. And so I drugged my feet for a couple of years, and finally I had the urge to look at it, and it just so happened the meeting was in Puerto Rico in February. It's like, good, I'll go. And it didn't take very long for me to realize that I was missing a whole lot of stuff. And I did also realize you don't have to dig really deep to find this stuff. And it's amazing to me that it's all right there. You Google in a few things and it's all right there. And the science is all on the side of the holistic dentistry. There's no science out there that says that mercury is safe. They've got nothing. They just say it is, and they say they've got the studies. Well, where are they? I haven't seen anything that say they're safe. There's a whole bunch that says they're not. So those days changed my life. It was 3 days in March about 4 years ago, and I couldn't come back and do the same thing I did just the week before. It was really interesting, but these people really struggle. These are my staff. They're awesome ladies, and you know, I came back and you know how we get kind of visceral reactions about vaccines. People are kind of like that. Well, tell a hygienist you're going to take away your fluoride. Wow. You just don't even go there at first. So I was like, okay. They were going to quit. I mean, they were really worried. And I came back and I started talking about mercury and we need to be safe with this. And I could never, ever take mercury out the same way I had done it just the week before. So I brought these masks back for my assistant. And she's like, you're kidding me, right? I'm like, nope. And we're using them right now. And we're never doing it a different way. And the hygienists, they just put their foot down on the fluoride. So I was like, all right, let's just focus on the fact that mercury is dangerous, and then we'll go back to the fluoride thing later. And they're finally starting to get it now. But the stuff is toxic, and we're taught that it's a vitamin. I mean, you could even actually buy vitamin or supplements for water. And we used to do that. We used to prescribe fluoride tablets for people who weren't on fluoridated water. It's absolutely absurd. And so this is what we were taught in school. I mean, we were taught that the fluoridation of water was one of the 10 greatest public health achievements in history. It's the greatest thing since sliced bread, and because of that, we have 25% less tooth decay. Where do they get that? How do they know that? I think it's absolutely crazy. There's no studies anywhere that show that. This is what we've got. These lines here, it doesn't really, it's kind of hard to see, but there's a lot of countries that don't fluoridate their water, and they've all had a decrease in cavities over the last however many, like 30, 40 years. There's no correlation whatsoever with who's fluoridating and who's not fluoridating. There's nothing there. And in fact, fluoride is some toxic stuff. We've got the topical stuff that we have in fluoride, and then we have the stuff that's in the water. They're very different. You guys are familiar with the difference of the two? The sodium fluoride is in the toothpaste, which is not really great stuff. But the stuff they put in the water is way, way, way worse. That's a byproduct from a fertilizer industry. It's like the leftover stuff that they don't know what to do with, as they put it in the water. And so it does this to our teeth. We've seen this. I see this every day, the little white spots on the teeth. And it's become normal now. Those, we call them freckles, or like it's nothing. It's just a little fluorosis on your teeth. Well, if the fluoride is doing this to your teeth, what's it doing to your body? Does it just go to the teeth? No. It goes to the bones, it goes to the brain, it goes to the thyroid, it causes all kinds of problems with it. They've shown lower IQs, all kinds of problems from having fluoride in there. So then what do we get to do? We get to do veneers. We get to make a whole lot of money, right? We get to do plastic teeth or porcelain teeth. They don't look right. I mean, the ones on the top, they've got fluoride, they've got the spots and all that, but the ones on the bottom, they may look a little bit better, but they don't look real. They're all one color, top to bottom, side to side. It just never is, it's just never right. So if we flood ourselves with fluoride, from the time we're little kids with that water, this is what we're gonna get. We're gonna get the spots. Some are worse than others, and then you gotta deal with that. This is one of my favorites, sealants. We've all heard about the sealants. You gotta cover the groove, right? No, we learned in school that if you can cover the groove of the tooth with this plastic material, with this bonding stuff, then you can block out all the bacteria and the tooth won't decay. It's a great idea. The problem is it doesn't work. It's absolutely crazy. There's bacteria down in those grooves, right? And the bacteria down there, they hate oxygen, okay? So if you cover that over, they say you're blocking out the bacteria. Actually, you're sealing in the bacteria that grow better with no oxygen. So now they're really gonna fester down in there. It's not a good thing. And they actually taught us that you can seal over a little bit of decay. So if you're looking in there and you see a little decay, maybe it's a little bit sticky, just seal it over, it'll be all right. But what never made sense to me is the cardinal rule, the biggest sin you can ever commit as a dentist is leaving decay in a tooth and then putting a filling in. What's the difference? Why would you leave decay in and seal it and leave decay in and put a filling in and it's bad? Never could quite figure that one out. Why am I the Lone Ranger here? I don't know. I really don't know. I figured this one out 20 years ago, right? When I got out of school, I was working with all these, these kids that come in for sealants, and I was always really adamant that I would clean out the groove. I'd take a high-speed drill and get a bunch of the enamel out of there. It's a real smart thing to do, but I would at least get the decay out. And almost every single time, even when I thought a tooth was perfectly healthy, there was decay down in there. It's hard to see. You can't always tell that it's in there. And even if it's just a little bit, I would never seal over it. I never thought that was a smart thing to do. So I take off old sealants, and I find massive problems underneath these things. I had a girl come in right when I opened my practice, and she was about 12. She had 4 sealants in her permanent molars. And one of them looked a little fishy, just looked a little shadowy, didn't look quite right. So I thought, maybe I'd probably take that one out. So I got in there, took that sealant off, and there was a massive, massive cavity underneath there. It was huge. And so I thought, if that was that bad, I wonder what's underneath the other ones. Mom agreed. We went in and took out another couple sealants. Same thing. They were huge. And then the last one we did, the one that I was the least worried about, the cavity was so big, it was into the nerve. So now she's 12. She needs a root canal, or we got to take the tooth out. We chose root canal. Now she is 22, the tooth is gone, and she has an implant. All because of a stupid sealant somebody put in her mouth when she was probably 6 years old. It's an absolutely ridiculous story. And I see it, this isn't something I see every now and then, this is stuff I see every single day, these sealants. So I look at them so carefully. This is what we've got. So we've got a tooth. Those grooves that come down in the tooth, on some people, they are super, super deep. And they just wind way, way, way down into the tooth. Why are those grooves there? Well, they hold bacteria in there. Well, God didn't screw up. It's fine. Those are supposed to have bacteria down in there. It's supposed to be the good bacteria, the stuff that balances out. That's the theory, as to why those grooves are there. But they get out of balance and they start turning into the wrong type of bacteria, and we add a bunch of sugar and we have other problems with our bodies, and it starts to break down. But you can't seal over that and expect anything good to happen. Like this right here, the one on the left, they sealed that. It doesn't take a dental degree to know that tooth's got a problem. And if you seal over that, just give me a blindfold. I don't know what's going on to that tooth now. No idea. There's a sealant over it. I can maybe see a little shadow, and this stuff doesn't show up on an x-ray. These cavities that are on the biting surface, you can't see those on an x-ray until they're so big you can see them from across the room. You don't need an x-ray. So it's an absolutely crazy thing. This one right here, see the little shadowing around it? Like that? Can you see that where it's kind of brown? That is an incredible amount of decay underneath that. But this picture I found on Google Images as a healthy sealant. That's perfectly fine. Just leave it like that. And so there's no holes in the tooth, right? There's nothing sticky. So if you take your little Explorer, I had dentists has a little pick thing, and they go and they drag, they're looking for sticky spots. That's what most dentists believe is a cavity. If it sticks, it's a cavity. If it doesn't, it's not a cavity. Well, baloney. That doesn't stick. I guarantee you there's a cavity underneath there, and it's going to be big. Those Explorer tips are big, grooves are small. You could take my Explorer away, I wouldn't even miss it. It's all about really good light, a dry tooth, and good magnification. If you ever go to a dentist and they don't have the funny glasses on, get out. They can't see. There's absolutely no way. And ideally, a really good light on the forehead right there. It makes all the difference in the world. This is what we find in there. And that's just the beginning of it. That mushrooms out underneath, and that tooth ends up with a thin shell of enamel around the outside of it. It's very weak. That's the kind of tooth that's going to be out in 5-10 years. It isn't going to make it. Yeah, all over a sealant. So the other thing is we got to ask is who's putting the sealants on? Mostly it's not the dentist, okay? And this is a cash cow. $35, $40 a tooth. They're doing the 6-year molars, the 12-year molars, maybe even the premolars, hundreds and hundreds of dollars per kid. And the dentist doesn't even walk in the room, okay? So you have a hygienist in there or an assistant, somebody that's maybe trained, maybe not. And they get in there and they kind of clean off the tooth a little bit, maybe. Well, they're not getting down in that groove, I can guarantee you. That they're clean. I mean, you can't clean down in there, it's impossible. Then they glob this thing on a 6-year-old that has to be completely dry to have anything that bonds at all. A 6-year-old in the back of their mouth, working by themselves, keeping it dry, yeah, good luck, doesn't work. It always leaks. And you get one little leak in one of these things, say you get lucky and there's one that has no decay in it and there's nothing down in those grooves. Well, the chances it's going to leak is going to be really, really good. So there's no bacteria in it now, but there will be. Because if that doesn't bond absolutely perfectly, you're hosed. And the other thing is they glob those sealants on, so it fills in that whole groove surface. Well, all those cusps and the valleys and all, it all matters. And if you start putting a pile of stuff in the middle of it, it changes the bite. And now that your teeth aren't hitting quite right. And so we inherently know not to bang our teeth together in places they're not supposed to, so we start to shift and move our bite. So now we've got a bite that may be shifting and moving and turning and going somewhere different. And fast forward 15, 20 years, we've got TMJ problems now because of one sealant in the back of the mouth somewhere. So I remember a long time ago when I was starting to put my foot down about these sealants, the staff didn't like it because they were paid on production. So they wanted to do the sealants, and I was saying no. I was the associate in the practice. So I walked in there, and these girls wanted to hurry up and put the sealant on before I even examined the kid. Yeah, it's pretty crazy. So I'm probably the most passionate about that. So first visits. This can be a really interesting thing for little kids. Kids inherently don't want to go to the dentist. Their parents don't want to go to the dentist. Nobody wants to go to the dentist. We shouldn't have to go to the dentist. There's nothing magical about going every 6 months. That's the first thing I tell everybody. There's nothing about this that you need to be here and seeing me twice a year. You might need to. You might need to see me more than that, but that's not our goal. We don't need to be reliant on a dentist. So the thing is about kids is they're pretty interesting little creatures. They read their parents. If you go in and you're nervous and scared, I promise you they will be nervous and scared. They will feed off of every single bit of that. So the more calm and relaxed you are, the more calm and relaxed they are. If it's no big deal. If you're going to go for a treat afterwards, they're thinking, uh-oh, probably not going to be fun. So just normal part of your day. There's a couple things too that you never, ever, ever want to say to your kid. I don't advocate lying to your kid, but you don't want to give them all the information. Never, ever say the word shot. ever. We don't have that in our office. We have sleepy juice. That's it. That's all we use. It's just sleepy juice. Honesty is good, but that's not helpful. And every now and then I'll have a parent say, okay, she's going to put the shot in your gums now. Thanks. That just went from an easy case to now one that's going to be not so easy. So be careful if you're over preparing with it. It just needs to be no big deal. So this is an interesting thing too here. Parents, if the kid needs to be in your lap, they're not ready. Okay, that's really true. And if I have a kid in a lap, I can't see the kid's teeth. If they're at an angle, it just isn't going to work. And then they're also feeling fear as you're holding on to them. If they can't sit in the chair by themselves, they're picking up on all kinds of problems. It's just, they really need to be big enough to sit in the chair by themselves and learn to trust the dentist. And that can be tough, especially if they've been violated before, and unfortunately a lot of them have. So you just have to start really, really slow with the kid. You start with a mirror. I give it to them and have them hold it. Okay. They might stick it in their mouth. They look at it. There's nothing sharp on it. And then they give it back to me. I lay them back, and they think they've helped me. I get the mirror back, and then we look with just a mirror. And we start like that. And sometimes that's all we do. Just build trust and go super, super slow. X-rays. Those are interesting too. I think insurance pays for x-rays maybe once a year, maybe twice a year if your plan is a good one. We don't need x-rays that often. Some do. Some need them every 6 months for a while, but not all the time. I'll go years without taking x-rays on people. Why do that? If somebody has no evidence of, no history of cavities, healthy gums, I'm not seeing anything on an x-ray, I can promise you that. And if you do a good exam, you can see well without even having to take one of those. If something is getting out of control and big enough to be treated, I can see it with my eyes. If you dry it off and use your magnification, you're going to be fine. So what are we looking at anyway with these x-rays? What is the deal? Why do we need them? Well, there's some differences between kids and adults. And what we're looking at is we're looking for cavities that are between the teeth, because those can be really tough to see, especially when they're just getting started. So the one on the left is the baby teeth. The one on the right is permanent teeth. The little shell around the outside, the enamel layer right here, on the child, it's very thin, okay? On the adult, on the other one, it's a lot thicker. Can you see that? So it takes a really long time for decay to get from the outside of that enamel to the inside of the enamel. And once it hits that line, right, well, you can see here where the decay is, once it gets right there, it can grow like wildfire, super, super fast. So that's the point where we want to catch a cavity. So if I'm determining, is this a tooth we want to fill or not, or treat or not, how big is it? How much is it growing? How fast is it growing? What's the history? If there's no other cavities in the mouth, this is the first one I found, I'm holding off. I'm not doing anything until I absolutely have to. But with kids, with that enamel layer being a lot thinner, you have to be a little bit more careful, because it's just, you don't have as much time to wait if there's going to be an issue in there. Panorex films, the big ones. I hardly ever take these things. It's like looking at a house from across the street and deciding if you want to buy it. You can't see anything in there. You can't see cavities in there. You can see that there's teeth. That's kind of it. I can't really see much else in there. Maybe some pathology, but I can tell you in 22 years, I've never found anything on a Panorex that was, had I not taken that Panorex, I would have missed it, and it would have been a really bad deal. It's just so rare. The only time to take these is going to be when your kid's about maybe 6 years old. Orthodontics maybe we're looking at that, and we want to know if the permanent teeth are there. Other than that, that's it. I think insurance pays for it every 5 years, so you don't need them every 5 years. It's an absolute waste. So nursing cavities or cavities in little kids, and I find this really interesting, and maybe you can help me figure this one out. But I went for years before my practice changed, and I rarely saw cavities like this in kids, and I was seeing the normal world. And then I switched over, and all my whole practice switched over, and I started seeing a lot more of this. And I don't know, I think what's happening is there's a lot of people sleeping with the babies at night, which I think on one hand is a really good thing to do, but if they're suckling all night long, it just bathes the teeth in sugar all night long, and that's where things get really, really dangerous. So meals are better than snacking when it comes to teeth, and these are the ones that really struggle. So the whole sleep with the baby thing, that's a tough one. I mean, we want to do that as parents. It's natural. I think that's part of who we are, but letting them suckle all night, that's when things get to be a big problem. So I think there needs to be some level of control with how much they're able to eat during the night. And we really shouldn't be eating while we're sleeping anyway, I don't think. So it pools in there. So that's why, some kids you can get away with it with one kid. You can sleep with them, they can eat during the night, they're fine. But then kid number 2 comes along and they've got this going on. Well, what's happening? Well, maybe they're suckling and it just pools there in their mouth for hours and hours and hours while they're sleeping. And then they take a little more and it pools a little bit more. And so it just breaks down and it doesn't take long. Breast milk has sugar in it, just like any other sugar. And the bacteria in the mouth really don't care what kind of sugar it's coming from, whether it's breast milk or an M&M or a Coke. It doesn't really matter to them. So, and with nursing decay, it can get it out of the hand really quickly because it starts behind the upper front teeth. And so you don't see it until it starts to move around to the outside. And once we can start to see it on the outside, you start looking on the inside and we realize we got a really, really big problem. This is not fun to deal with. So then can we heal teeth? Had you asked me 4 years ago, I would have said, no, you can't heal teeth. That's ridiculous. But what's ridiculous is the thought that our bodies can heal themselves everywhere. Our skin, our bones, everything can heal. But our teeth? Well, of course they can heal. They're a part of our body. They're a living part of our body. And so you can't regrow a cusp like enamel. That's not going to grow back. But if you have soft, sticky, mushy, broken down tooth, it can remineralize and get hard again. And I know that because I've seen it with my own 2 eyes. I've learned so much from my patients that I've seen over the last few years. I'll never forget seeing a little kid. She was probably 4 years old, and she looked kind of like that other picture over there that I showed you. And Mom wanted to try to heal it with her diet. And I'm open to the idea at this point, but really skeptical. I said, okay, that's fine, do your thing. I'm curious to see how this happens, and just let me see her again in like 3 or 4 months. So I want to make sure there's no infection or anything like that. So the kid came back 3 or 4 months later. Those brown spots were now black spots, and they were hard as a rock. She completely healed that with the diet. It was amazing. So black spots aren't a bad thing. What that means is when you have a cavity there and it's moving really fast, it's lighter in color because it's breaking down and leaving quickly. If it's slowing down and it's getting healthier, it's picking up stain and it's hanging around. So that's a good thing. So if you see it getting blacker, contrary to popular belief, that's actually okay. We want to see that. So the other thing, we were taught in school too, that cavity comes from sugar, bacteria, and a tooth. Well, that is true. There is a topical effect. But what they never taught us was that the teeth are still connected to the body and they can heal. So what happens, there's this fluid flow that goes from the inside to the outside all the time through the teeth. They almost sweat in a way. So if that's flowing and moving and we're pushing bacteria out, we can be a lot more resistant to the same amounts of sugar if our body wasn't healthy. So if you're out of balance with your vitamins and your minerals and all of your nutrition, then that fluid flow stops. It starts to suck things in. Things are going to break down really, really fast. But if you can get that fluid flow going again, that's when things can start to heal. And that happens with vitamins A, D, E, and K. Those are the big ones with that. Romeo Nagel's book, How to Heal Teeth Naturally, has got some really good information in there. Cod liver oil, healthy fats, those are the things. Bone broths, all that stuff is amazing for the teeth. And it's absolutely critical if you want to heal the teeth. It is a huge commitment to get that to happen. It has to be really good. So Jesus in a bottle, Jesus in a syringe. I use ozone oil all the time, and I also use ozone gas. This stuff is amazing. I've got a machine in my office, it's medical grade. I can pull off a little bit of ozone gas, and I can flow it, we hold some suction there, and I just flow it over the tooth for about a minute, right over a cavity. If it's just getting started, it's not real big yet, we just flow it over there. Do that, once a month for a few months, that cavity can heal. It's very, very helpful. It kills all the bugs down in there. It gets blood flow to the area, and it simulates healing in the tooth. I got a phone call. I started using this ozone. Like I would do a cavity, I would drill that out, and it'd be kind of deep, and I'd be kind of nervous, thinking this might need a root canal, So I started using ozone on these teeth that had the deep cavities. And about 3 months later, I got a phone call from a friend of mine who's my root canal specialist and has been for 20 years. He's like, "Are you mad at me? Did we do something to upset you?" And I'm like, "No, why?" He goes, "Well, I haven't seen any of your patients in a couple of months." I was like, huh. Yeah, I guess you're right. I haven't sent anybody your way. Nobody's needed a root canal in the last few months because I've been using ozone. It's fascinating stuff. I mean, teeth that I thought surely were going to die. I actually had a pulp exposure. If I ozone treated it, it almost never needs anything. It's going to be fine. It'll heal over and it'll be okay. Well, the interesting thing about that is he had no questions. He didn't want to know about what I was using. It's so frustrating. Yeah. But this stuff, ozone's been around since World War I, long time. And burns, you betcha that'll heal a burn. I had a friend of mine came in and I saw her just out in the world, and she had a big burn in her foot. And it wasn't healing. 10 days had gone by and it was just still raw and bleeding and sore. And I said, well, come in my office, I can help you. She's like, you're a dentist, this is my foot. I said, just come in and I'll see what I can do. So I put some ozone gas in a plastic bag and just had her sit there for about a half an hour. We did that a couple of times. Within 24 hours, she started to heal. And within a few days, it was just completely gone. I had a friend of mine had knee surgery. He had a knee replacement done. And so I said, well, I'm curious to see what would happen. Come in after your surgery and let's put your whole leg in a bag of ozone and let's see what happens. So he did that and he came back. A couple months later, I was working in there on a Friday and he wanders in and he goes, just wanted you to know something. I'm like, what? He said, my doctor and my physical therapist want to meet you. I was like, why? Did something happen down there? Or am I in trouble? He's like, no, they've never seen anything heal like that. There's no scarring. It healed way faster than they've ever seen before. What was interesting to me with that one is they were actually curious. So there's a huge lack of curiosity out there. So prevention and home care. Prevent the cavities to begin with. Diet is their absolute number one thing. Like we said, it's not just topical. It's not just the sugar that we're eating, but it's having everything in balance in the body. But it's also keeping the teeth really clean. You got to get the plaque off of there. If you got bugs on there, then you're just setting yourself back. Plaque's not hard to get off. You just have to know what you're doing in there. And what's a little bit counterintuitive is the number one place I'll look to see if there's going to be healthy gums or not is right here, lower front teeth, kids and adults. That is an awkward position to do that. And the lip will start to push up, and if that gets a little sore, it gets a little raw, a little gingivitis in there, that lip just pushes right up, and we don't brush there. We don't think about it, but we don't want to hurt ourselves, so subconsciously we just miss. And so the back is usually cleaner than the front. So when you're working with your kids' teeth, you got to make sure that you're getting on the gum line, okay? And if you see bleeding, bleeding is never, ever, ever normal, okay? So it's a little counterintuitive with this. Every time you brush, you want to try to make your gums bleed. Probably never heard that before, but you do. If you're brushing in there and you're really working on the gums and you can't make them bleed, that's when they're healthy. That's when they're super, super healthy. If you're able to brush in there and floss and make them bleed, they're not healthy. So it works kind of like a callus. You know, where like at the beginning of summer, you go outside barefoot and it kind of hurts to walk down the road. Well, by the end of the summer, you've been barefoot for a while and now it doesn't hurt anymore. Same thing with the teeth and the gums. They get stronger and tougher. And so if you ever see bleeding in there, that's your body saying, attack it, get it, clean it. And within a couple of days of doing that, you won't be able to make it bleed anymore. It heals amazingly fast once you get the bugs out of there.
So you say if you see bleeding, you keep doing it?
Yes.
Until it doesn't?
Yes. Yep. And it just usually takes a couple of days of really good focused work in there. So the same thing when you're flossing. Make sure when you're flossing, you get all the way down below the gum line. So people tell me, oh, I only bleed when I floss. And I'm like, okay, well, there's more going on than just that. Any bleeding, it tells me that there's issues in there, but you've got to go way down and, you know, you can maybe be somewhat careful, but really work in there. Don't be scared if it bleeds. That just means keep doing it. I promise it'll go away. And kids don't innately know how to brush their teeth. 3-year-olds can't do that effectively on their own. They just can't do that. They don't have the manual dexterity to do that, but they need to practice. So give them a toothbrush, let them brush their eyebrows with it, whatever, that's all fine. But they still need you to help them with it. And one of the things that will help them, especially when the kids are littler, if you go at them with a toothbrush like this, it's kind of that scolding position, they don't like it. And so if you can put them up their back against you, kind of like you're giving them a hug, or if they're still in a high chair, right after dinner, just come up and do it then. You know, everyone's tired at night, bedtime, you gotta brush the teeth, it's just not a good time. So it doesn't matter when during the day you brush the teeth, just get the plaque off once a day and you're good. Yeah, you don't have to make it a big deal. You don't want to make it a negative thing either with the kids. So there's a couple options out there for doing fillings. We don't ever want to do this if we don't have to, but sometimes it does make sense to do some restorative work in there. I never use mercury, and I would never go to anywhere that did use mercury. They still use it all the time. It's still considered to be safe, and you still have to do it on the boards to become a dentist. You have to be able to do a mercury filling. But composites can be done, or the white fillings can be done. They're harder because it has to be completely dry in there, and that's hard to do when you got a 4-year-old in your chair and they're not sitting still, and to keep it totally dry it's really tough to do. And there's not a very big they have a harder time staying in. I struggle with this because they break a lot. These fillings, they come out, and it drives me crazy. I don't want to have to do it again. But that enamel layer is so thin, that's where the bonding strength comes from. And because it's so thin on little kids, you can't get a good strong bond. And so it's tough. So it's a big decision. We decide to go into a tooth and do a filling, especially when they're in between, because you can never get that integrity of the tooth back, and we're going to be struggling with it for years. Usually we're going to be dealing with it over and over again. Crowns may be presented. These little silver things. They've got ones that have like porcelain on them now, but we don't like to put metal in the mouth, but if you want one that's going to last and work in there, it needs to snap over to stay on. So it's a catch-22 on that. If you want to save the tooth, you don't want to lose it, and it's not strong enough to hold up a filling, you're going to need to cover and protect it. You know, in some cases, that's the lesser of two evils. Crowns can be done on the front too. They never look very good, but a lot of times it's better than losing the teeth if they do have bad decay problems and you're looking at taking them out or doing the crowns. If you take them out too early, it can mess with their speech and their growth and development. I mean, those roots are important to guide in the permanent teeth, so you do want to keep them in there if possible. And if you can get the decay to arrest, even though it doesn't look great, you can just leave them in there, you know. If the aesthetics isn't a big problem for you guys, then just keep the teeth in there. That's way better that way. If you do decide that you have to take one out, then you need to do space maintenance on a baby molar. On the front, you don't have to worry about the space, but on the back, you do. On the second molars back in there. So they don't all need space maintenance, but if the dentist says that it does, chances are that it does. And if we don't do that and things start to collapse in there, so if you take a tooth out, everything just collapses into that spot. Okay, the tooth in the front, the tooth behind go like this, the one on top goes down like that. So you have to hold that upright, otherwise the tooth coming in underneath it won't have any space. It just collapses in and blocks it out. So if they do come out early, space maintenance is super, super important. So with orthodontics, that can be, it's important to catch that early. If there's issues, usually when you're little, the thing that we'll treat early on is space issues, or if they have a narrow palate, then we'll refer a lot earlier. That space right there is beautiful. We love the space. If they're lined up like a picket fence like that, you're good. That's what we want to see. If they're touching and they're 3 years old, I guarantee you've got a crowding problem going on in there. So we like to see the space. So you can't miss the window of opportunity. This kid here can't breathe. His maxilla is too small, is not growing. There's some studies out there showing that it's a lack of proteins and fats during growth and development. Kids didn't used to have these kinds of problems, but we do now, and I think it's all nutritionally based. But I see this all the time, these what we call cross bites. That's when the lower teeth are actually on the outside of the upper teeth. That traps the maxilla in there and it can't grow. So this whole part of the skeleton can't grow. It messes with the sinus, the swallowing, the breathing, all of that stuff. These are orthodontic emergencies. And if you see something like this, they need to get to your orthodontist right away. You've got to get that opened up, or they're going to really struggle with their health in a lot of different ways. It is so important. So truth passes through 3 stages. First, it's ridiculed, which is still where we are, I think. And then it's opposed. We're definitely there. And then it becomes accepted as self-evident. We know we're on the right path. This is absolutely the way to go. I don't understand why dentists do what we do. I think a lot of it comes from, like we were told in school about mercury. We weren't just told that mercury was safe. We were told that it's safe and effective. And if you think it's not safe and effective, then you're a kook and a quack. You're a scam artist because you're conning people into thinking that you can heal their other health problems. And so there's a really negative social connotation that goes along with that. So when I start bringing this up with my friends, they don't want to hear about it. They don't want to be associated with that. They don't want anything to do with it. And so for me to take that step, that's a big deal. I mean, there's a lot of people who think I'm just gone off the deep end. And I don't care. I'm seeing all their patients. So they're all coming to me. And I absolutely know that what we're doing is the right thing. You know, it's harder to make money like that because I don't do as much dentistry, but that's okay. I'd rather do the right thing rather than make a whole bunch of, just have these mills going on. And, and why do they do that? If you go to the dentist, you see a waiting room full of people. You see all these chairs lined up. You get all these girls walking around, this chaos going on. Insurance has absolutely killed the quality of medicine and dentistry. Dentistry used to be more like this, but what's happened is I don't know if you guys know how the insurance thing works, but if you're a provider for Delta Dental, which fortunately I'm not, I can't be. I take too much time with these patients. I can't do an exam and get paid what, $40 for it. It's $20, I think is what they allow, Delta Dental. It's an absurd amount. And so what happens is you have to move faster. You have to see a volume of patients. And that's why we have assistants doing cleanings when it should be hygienists. We have assistants doing fillings in Missouri. I'm not sure about Kansas now, but I know that in the state of Missouri, the dentist can come in and drill out a filling, and then he can leave. She comes in and puts the filling in. That's the hardest part. That's crazy. I would never allow that. Always, always, always ask who's cleaning your teeth. Is it an assistant or is this a licensed hygienist? They are not the same. Not all hygienists are the same. If they're not probing and checking the numbers, like the depth of your gums, get out of there. They're not paying attention. The dentist should be asking those questions too. But the insurance has just forced the situation to where you have to move super fast or you're going to be broke. So you guys are the advocates. You know, when I started dealing with this a few years ago, I came back from that first meeting at the IAOMT overwhelmed with information. I didn't really know anything. And then my patients that started coming to me, I had no idea the demand, no idea. I just did this so I could help my husband out and get the mercury out of the mouth. And my phone started ringing off the hook, and I was just really honest. I said, look, I'm new in this. I believe this is the right way to go. Teach me. What do you know? Tell me. Like watching this girl, the mom help her kid get healthy. I saw these cavities heal right before my eyes. I never would have believed that before. But people are very, very knowledgeable. You guys are the most well-researched ones, and you're going to drive other dentists absolutely insane. You've all experienced it, right? You ask questions about fluoride, and they roll their eyes. You don't want x-rays, and they might kick you out of the practice. Yeah. It's because that's just what they've been taught. I don't think they're trying to do harm. That's just what they've been taught. So, any questions from anybody?
What do you think about oil pulling with the ozone?
Oil pulling is great. Coconut oil is really good for your teeth. It doesn't take the place of getting the plaque off. So number one is always get the stuff off of there, and then oil pulling can be really helpful to help soothe and clean, and it's got a lot of what's the acid called? It starts with an A. Arachidonic acid in there. It kills bacteria, so it's a good thing. It's not going to get deep down into the pockets of the gums, but it's good. It feels good. It's good for whitening. I have a lot of patients that do that.
What if you have a child that has a filling? What do you do?
Like a silver filling?
Yeah.
How old is the kid?
He's 5.
Is it a baby? Probably a baby tooth.
It's in the back.
Yeah.
I'm sure it's a molar. It's not
Being
one of the new ones.
5, yeah, it's probably a baby tooth. That's a tough one. In the process of taking it out, it's pretty overwhelming. It looks like that. I don't want to do that to a 5-year-old.
Yeah.
And so if he's healthy and if he's not having, heavy metal detox issues like that, I'd just leave it in there. Yeah. Those molars usually about when they're 11, 11, 12, something like that. But yeah, and that's a judgment call every time. I mean, if the kid has got, a lot of heavy metal toxicity issues, then yeah, we may need to get it out. We may choose to pull the tooth instead of trying to do another filling in it. Because even if I do all of this stuff, it's still going to you're going to get a bolus dose of mercury. I do, kid does, everybody in the area does, even with that. So.
Contact information for appointments.
Okay, yeah, it's Julie Babcock, it's Babcock, and it's 913-814-7755.
What about wisdom teeth?
Oh, wisdom teeth? Yeah, go ahead, you finish yours.
So you showed a picture of I would say the mouth was pretty much rotten out, and
Yeah.
And you said that you contributed to night nursing. Is
Yes.
that prior to teeth coming in or after the child has a full mouth of teeth?
After they're in. Before they're in, doesn't matter.
Okay.
Yeah, but I think the tough part of that is developing the habit of letting them suckle all night long. The teeth come in, and then trying to stop that's going to be a lot tougher. Yeah.
So with regard to wisdom teeth,
Yeah, it's not a rite of passage. 18, they don't have to come out.
yeah, and that's something that I guess, is it because maybe things are getting so hard for them, like the spacing issue? Is that
Yes,
part of it? Why
yeah.
do they have to have it? I don't know.
Well, our jaws have changed. I mean, a long time ago when we were eating a lot harder, roughage, harder things. We had stronger jaws, we had bigger jaws, we had stronger muscles, and we had room for those teeth back in there. Now that we're not doing that anymore, we're not chewing the same, our muscles aren't the same, the bone isn't as big, there's no longer room back in there. And so those are the ones that sometimes need to come out if they're impacted. But just because they're in there doesn't mean they have to come out. I leave them in there all the time, and the people are fine. The problem is if they're maybe partially erupted and you can't clean them, they're kind of down back around a corner, and you just can't keep them clean. Then they're going to get infections around them, and then that's the point where we decide that we need to take them out.
I mean, I guess for myself, it was just that, oh, they're going to come in at an angle, we need to take them out. And you're like, okay, you do what they say.
Yeah.
I'm like, there was nothing wrong with them.
Right.
So for my children, looking forward, just let them grow, and if
Yeah.
it starts bothering them, then you address it then.
Yeah, pretty much. Yeah, and there's a myth too. This doesn't happen. If you leave those in there, wisdom teeth are not going to push the teeth together and crowd them. That is not linked. Most people think it is. It is not. It's not the eruption of those wisdom teeth. It's other things going on with the bite, but that's not to blame. Because that happens the same with people that don't have wisdom teeth. They still crowd down here. Yeah.
What about pulling the baby teeth to have the adult teeth come in? Is there...
Oh, like orthodontically? Yeah, sometimes you need to do that. If there's some serious space issues, you've got permanent teeth coming in, like on the lower down here, sometimes they'll erupt behind, and it won't dissolve the root. That baby teeth needs to come out.
So if the adult teeth are not coming in yet, do you ever see a need to pull the teeth to...
Sometimes, if there's a serious space issue, and I'm working with an orthodontist that I trust, and he thinks that we need to do that, then yes. But that's always combined with space maintenance and other types of things that we use to help grow the palate. We never just take them out and they'll just collapse back in again. It gets worse. Yeah.
Another question I had was with the pulling of teeth, are those teeth are connected to organs in the body?
Yes, absolutely.
So should we take caution as far as pulling those?
Well, it depends. I mean, if you have an infected tooth, a root canal treated tooth, something like that, it's better to get it out of there than to leave it in. So the problem isn't so much the extraction of the tooth that causes a problem with the rest of the body, it's leaving an infected one in. It's like 97% of women with breast cancer have a root canal on that side, and it is almost always an upper molar. Scary, isn't it? That's the acupuncture meridian it's connected to. Yeah, it is.
So I have a child that has a tooth coming in behind her teeth.
Uh-huh.
What do you do with that?
Baby teeth have to come out. I take them out. The baby teeth?
Okay.
Yeah, once you do that, it allows that permanent tooth to come forward. The tongue will push it there. But if that's...
It needs to come out
Yeah.
early.
Yeah. Yeah, well, it's not really coming out early. It's just because it came in too far this way, it didn't dissolve it. But that's indicating another problem. There's not enough space in there. That's why those are erupted so far back. So there's more things going on in there than just that.
And no one ever told me that.
Yeah. Yeah. Well, the main thing I look at for kids is, and I want to know if they've got space problems before they're 7. Because you can do a lot of good things as far as widening their palate and helping that along until they're about 7 or 8 years old. That's when that suture closes and you can't open that anymore. Yeah, so you got to get them early.
What do you think of the mild munchies?
The mild munchies, that's kind of new. I've seen those. I don't really know yet on those. I mean, I think it's kind of back to an old, if I took the lips off, the teeth would flare out. If I took your tongue out, they would go in like this. So the teeth are really formed in there because of the muscles that are hung in our lip. And so the myomunchie just takes that muscular component out and it lets things straighten out and grow. I think that's part of it. And it works with the muscles too. I'm not really sure about that.
Let's do 2 more questions.
Yeah.
Does your toothbrush matter?
I love the Sonicare toothbrush. That's the vibrating one. It doesn't turn or spin. They're not cheap. They make a huge difference. I thought they were hokey in the beginning. I see a massive difference with Sonicare users versus non-Sonicare users.
And what about like the water pick?
I've heard mixed on that one. I'm not a huge fan of the water pick, but I like good old-fashioned floss. Yeah.
Old-fashioned floss.
Yeah. Toothpaste. Not a big fan of fluoride. Other than that, like with kids, find one they like. That's so important. You don't want to make brushing something negative. You don't have to use toothpaste if you don't want to. And little kids, if they don't like it, just don't use it. I love the charcoal-based toothpaste, and I have different ones depending on what's going on. If there's gingivitis going on, I've got one that I like. It's more of a wheatgrass-based one that's good for inflammation and bleeding, but I like the charcoal ones too, and the bentonite clay in it. You guys have some of that magic mud. Do you have it here too? Yeah.
What's it called?
Magic mud? Yeah. It's black. Have you guys seen charcoal toothpaste?
I've used just activated charcoal.
Yeah, I like the paste. It's a lot easier to use. It doesn't go everywhere.
Because I've heard you're only supposed to use that.
Some of it can be, if it's the right stuff, it's cut right, it's not going to be as abrasive. So the magic mud should be all right. Yeah, love that stuff.
Thank you, Julie.
You're welcome.